channel called CS. This is a brief video about the Psychiatry and Industry of Death Museum that is funded by CCHR, the Citizens Commission on Human Rights. And I thought it would be fun to start this video with this video to let people see what this video is about, what this museum's about. I think it's a healthy look at psychiatry.
Hi, I would like to invite you to an eye-opening museum. It's about psychiatry and industry of death. There's a lot about psychiatry that people don't know. Its history is horrifying. It's full of pain and terror. From its early tortures to its modern restraints. From electroshock therapy to dangerous drugs. Psychiatry has for a great deal of time created a lot of pain and no gain for humanity. Psychiatry does not cure anyone. It destroys people's lives, and this is based on actual statistics. Psychiatry scored a 99% failure rate in patient recovery. In the last 40 years, nearly twice as many Americans died in government psychiatric hospitals than all American wars combined since 1776. More than 20 million children are on prescribed psychiatric medication. These medications are known to cause violence, psychosis, hallucinations, suicide, and homicide. These disorders do not exist and have not been scientifically proven. There are just so many horrible facts about psychiatry. The list is long and terrifying. Psychiatry does not come from methods of healing. It comes from brutal practices of torture. It is not a science, but a money-driven industry with no intention of curing people's mental problems. They are destroying people with lies. Get the real facts here. Visit cchr.org or visit the Industry of Death Museum in Los Angeles, California. You'll be terrified of the origin of psychiatry and what is still going on today.
Now, I think we should take another look at that real quick, just so that in case you missed anything.
Hi, I would like to invite you to an eye-opening museum. It's about psychiatry and industry of death. There's a lot about psychiatry that people don't know. Its history is horrifying. It's full of pain and terror. From its early tortures to its modern restraints. From electroshock therapy to dangerous drugs. Psychiatry has for a great deal of time created a lot of pain and no gain for humanity. Psychiatry does not cure anyone. It destroys people's lives, and this is based on actual statistics. Psychiatry scored a 99% failure rate in patient recovery. In the last 40 years, nearly twice as many Americans died in government psychiatric hospitals than all American wars combined since 1776. More than 20 million children are on prescribed psychiatric medication. These medications are known to cause violence, psychosis, hallucinations, suicide, and homicide. These disorders do not exist and have not been scientifically proven. There are just so many horrible facts about psychiatry. The list is long and terrifying. Psychiatry does not come from methods of healing. It comes from brutal practices of torture. It is not a science, but a money-driven industry with no intention of curing people's mental problems. They are destroying people with lies. Get the real facts here. Visit cchr.org or visit the Industry of Death Museum in Los Angeles, California. You'll be terrified of the origin of psychiatry and what is still going on today.
So you'll remember that the National Socialist government of Germany prescribed euthanasia for what they considered lives that weren't worth living, which included people with psychiatric disturbances, okay? So physician-assisted death for patients with psychiatric disorders is a controversial topic of increasing relevance since a growing number of countries are allowing it. A growing number of countries are allowing it for psychiatric disorders. Disorders that aren't even proven to exist. General requirements for physician-assisted death include that patients possess decision-making capacity, meaning they can actually understand what's going on. to decide on physician-assisted death and their suffering is unbearable and irremediable. In the Netherlands, physician-assisted death has been eligible for patients with psychiatric disorders since the 1990s, making it one of the few countries that can offer insights on the practice from real-life experience. Much of the literature describing these experiences is only available in Dutch. This article aims to make this knowledge more widely available and provide a comprehensive overview of the experience of physician-assisted death. Now, you might take note that this is what's going on in Canada now. Physician-assisted death is a controversial topic. Public acceptance appears to be on the rise, and countries around the world are legalizing a form of assisted death. So this is eugenics without any improvement to the species, just getting rid of people that, people don't like, essentially. An ever more controversial topic is whether to allow physician-assisted death for patients with a psychiatric disorder, which is possible in only a few countries such as the Netherlands, Belgium, Luxembourg, Switzerland, and soon also Canada. It's available in Canada now. Many countries choose to exclude psychiatric suffering as a justifiable ground for physician-assisted death, either explicitly by demanding that the cause of suffering is physical, in other words, provable, or more often implicitly by installing a criterion that death has to be foreseeable. This exclusion is a topic of academic and societal debate. In the Netherlands, physician-assisted death is possible for patients who have a voluntary and well-considered death wish, and who suffer from a medical or psychiatric condition that is unbearable and irremediable. Although physician-assisted death due to psychiatric suffering has been possible since the 1990s, until 2010, only a few cases were reported yearly. However, in 2011, there has been a remarkable increase, with 115 cases being recorded in 2021. The most recent year for which figures are available. This makes the Netherlands one of the few countries in the world that can offer insights on the practice of real-life experience. Because of this exceptional position, patients, clinicians, activists, ethicists, and policymakers from around the world often refer to the Netherlands when debating physician-assisted death for psychiatric suffering, sometimes cherry-picking facts and figures to support their own standpoints. In the meantime, many sources that accurately describe the situation in the Netherlands are only available in the Netherlands. This increases the risk of misunderstandings and hamperings or a rational and informed debate. So this is about the history of it. So the current debate, blah, 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 originates in the 70s. General practitioners raised awareness of the tension they experienced. So what it is the poor physicians have tension because they can't alleviate the suffering and the duty to preserve life. It's so hard. So some admit it to occasionally helping people to die at their own request. So murder, essentially. Anecdotal evidence suggests that these cases mainly concerned cancer patients with a terminal diagnosis and a limited life expectancy. I strongly suggest people check out the website Chris Beat Cancer and the YouTube channel Chris Beat Cancer. Strongly recommend that. Persons who wanted to die because of psychiatric suffering were not yet discussed. A growing societal movement advocated for more transparency and regulation of assisted death, culminating in the establishment of the Voluntary Euthanasia Foundation. Sounds lovely, doesn't it? In 1973, a member of this foundation, Mrs. Wertheim, helped an older lady to die at her request. She was charged with assisted suicide in 1983 and sentenced to 6 months of suspended imprisonment. In the verdict, however, the judge gave the first outline for due diligence requirements, blah, blah, blah. The first psychiatrist to publish about physician-assisted death for psychiatric suffering. So this is a psychiatrist, mind you, a psychiatrist, to publish about physician-assisted death for psychiatric suffering was Dr. F. Van Ree in 1982. He wrote a commentary in the Dutch Journal of Psychiatry describing 3 patients with persistent suicidal ideations. 2 eventually committed suicide in a humane manner, unassisted but also unhindered by the mental health professionals. And 1 patient eventually recovered after long and involuntary clinical treatment. So, and this is the one thing that I would like to point out. I do strongly suggest unlike CCHR, I do think there are cases where people can be put into facilities to protect them from themselves and to protect society from them. I think that's a legitimate reason to put somebody in a medical facility. However, I do not agree at all in poisoning the person with neurotoxins against their will, which means I do not agree with using psychiatric medicine to treat, in heavy quotations, the person. I think that is poisoning somebody that cannot comprehend the long-term effects and cannot receive and does not receive informed consent, but assuming that they really are so mentally deranged that they're a harm to themselves or society, how could they actually have informed consent? And the same thing holds true regarding this situation with the concept of assisted death. So at the start of the 1990s, the Dutch Psychiatry Association and the Royal Dutch Medical Association both issued a statement that if physician-assisted death was allowed for somatic suffering, meaning suffering that can be proven, it should also be allowed for psychiatric suffering. In other words, suffering that cannot be proven to exist. This viewpoint was confirmed in 1994 by the ruling of the Supreme Court in the Chabot case. This case received much national and international attention and formed the basis of numerous publications about physician-assisted death for psychiatric suffering. In the following years, it concerned a 50-year-old woman with a depressed mood who wanted to end her life after both her sons had died. Over a period of 2 months. Now, this is not a reason for her to die. This is a reason to incorporate the concepts of logotherapy and to encourage this woman to recognize that all lives are worth living. All lives are of value, even her life that does not have children in it. But that's not what happened. They didn't go to Viktor Frankl. They didn't go to Dr. Frankl. They went to Dr. Kevorkian. Over a period of 2 months, psychiatrist Chabot let her stay in his private guest house, which I think is questionable. Why is he allowing this woman to stay in his guest house? And met with the woman to discuss her death wish. She refused psychotherapeutic or psychopharmacological treatment. And this is when you should be able to, if she's a harm to herself, which it doesn't seem like she was, if she had to be assisted, after establishing that she was mentally competent and that there were no treatment options left, how is she mentally competent if she wants to end her life? He assisted in her death by prescribing medication. Although he later stated that he consulted 7 colleagues, none of these other psychiatrists examined the woman themselves. Chabot was found guilty of assisted suicide, but no penalty was imposed. 4 years after Chabot's arrest in 1998, the first guidance, yada, 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 yada. Okay, rules and regulations. The Netherlands, assisting in the death of another person is punishable by law. However, if you're a physician However, if physicians follow due care criteria as described in the Termination of Life on Request and Assisted Suicide Review Act, they literally have a license to kill. That's wonderful, isn't it? Just think, they could forge the documents. Oh my! But that would never happen. Not in a mental health facility of all places. The physician must be satisfied that the patient's request is voluntary. They could just say that. Be satisfied that the patient's suffering is unbearable. Again, they could just say that. Inform the patient of his or her situation and further prognosis, which doctors are not perfect. They could be wrong, and also they could just be lying and saying they're doing that, like doctors do when they prescribe psychiatric medication. They could discuss the situation with they should discuss the situation with the patient. Again, they could just say they're doing that, and they exercise due medical care and attention in terminating the patient's life or assisting his or her suicide. Again, they could just say this stuff. There's no way to really regulate this. Moving on. Now, I've already gone over this, but I want to go over this again. This is about antipsychotics and their role in affecting fertility. Okay, so antipsychotics affect fertility through changes in prolactin level, as the typical antipsychotics are regarded as the most common medications related to hyperprolactinemia. They lead to acute and persistent increase in prolactin levels and thus affect hormone balance. Female fertility, the great response of prolactin in women of reproductive age who are not nursing or pregnant, leads to the inhibition of normal pulsatile secretion of gonadotropin-releasing hormone of the hypothalamus. These not so frequent pulses of blah 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 blah, greater than impairment, if the release of the egg is compromised, sperm cannot be encountered and fertilized. So this is male fertility. Even in men, antipsychotic medication can lead to infertility. No sperm could be present in the ejaculate. Likewise, men could suffer from difficulty maintaining an erection and decreased sexual desire. All patients treated with these prolactin elevating agents should be questioned regarding their menstrual cycles, and prolactin levels should be monitored, which they are usually not. Should disruption of menstrual cycles occur, the dose may be reduced if clinically feasible. The increase in prolactin that occurs through the use of conventional antipsychotics develops over the first week of treatment and remains elevated throughout the period of use. So throughout the whole use, once treatment stops, prolactin levels return to normal within 2 to 3 weeks. So what you have to understand is this is essentially the purposeful sterilization of people. Okay? These drugs have not been shown to be very effective, but what they have been shown to be effective in doing is sterilizing people. Psychotropic drug levels in seminal fluid, a new therapeutic drug monitoring analysis. Infertility, which is defined as the failure to obtain a clinical pregnancy after at least 12 months of regular unprotected sexual intercourse, can be due to male factors in about 30 to 50% of cases alone or in combination. The effects of many drug classes, chemotherapeutic agents, antihypertensive drugs, 5A reductase inhibitors, antibiotics, and psychotropics on male reproductive system have been evaluated in several studies with inconclusive results. Psychotropic drugs are largely used worldwide and frequently prescribed to patients, representing some of the most used drugs, with prescription prevalence in the general population ranging from 6% to 15%. Several classes of psychotropics have been associated with reduced male fertility, mainly due to 3 pathophysiological mechanisms: increased prolactin and gonadotropin levels with testosterone reduction, so they reduce testosterone; sexual dysfunction, primarily affecting erection and ejaculation, and it messes up semen quality. Although the hormonal changes and the sexual dysfunction may affect sperm quality, a direct spermicidal activity and other toxic effects of psychotropics have been reported in vitro. So they do have a direct spermicidal activity in vitro, such as antidepressants, SSRIs, okay? Therapeutic drug monitoring represents a blah, blah, blah. My point is that these drugs are sterilants. They're more effective as sterilants than they are for their intended purpose. Before I end this video, I'm going to continue with Angela Davis and BLM and how they are openly anti-American Marxists. But before I finish, I just want to watch this video. I want to leave you with this video one more time so you can understand the reality of psychiatry.
Invite you to an eye-opening museum. It's about psychiatry, an industry of death. There's a lot about psychiatry that people don't know. Its history is horrifying. It's full of pain and terror. From its early tortures to its modern restraints. From electroshock therapy to dangerous drugs. Psychiatry has for a great deal of time created a lot of pain and no gain for humanity. Psychiatry does not cure anyone. It destroys people's lives, and this is based on actual statistics. Psychiatry scored a 99% failure rate in patient recovery. Psychiatry scored a 99% failure rate in patient recovery. In the last 40 years, nearly twice as many Americans died in government psychiatric hospitals than all American wars combined since 1776. In government 40 years, nearly twice as many Americans died in government psychiatric hospitals than all American wars combined since 1776. 40 years, nearly twice as many Americans died in government psychiatric hospitals than all American wars combined since 1776. 40 years, nearly twice as many Americans died in government psychiatric hospitals than all American wars combined since 1776. More than 20 million children are on prescribed psychiatric medication. These medications are known to cause violence, psychosis, hallucinations, suicide, and homicide. Children are on prescribed psychiatric medication. These medications are known to cause violence, psychosis, hallucinations, suicide, and homicide. Children are on prescribed psychiatric medication. These medications are known to cause violence, psychosis, hallucinations, suicide, and homicide. Children are on prescribed psychiatric medication. These medications are known to cause violence, psychosis, hallucinations, suicide, and homicide. Children are on prescribed psychiatric medication. These medications are known to cause violence, psychosis, hallucinations, suicide, and homicide. These disorders do not exist and have not been scientifically proven. There are just so many horrible facts about psychiatry. The list is long and terrifying. Psychiatry does not come from methods of healing. It comes from brutal practices of torture. It is not a science, but a money-driven industry with no intention of curing people's mental problems. They're destroying people with lies. Get the real facts here. Visit cchr.org or visit the Industry of Death Museum in Los Angeles, California. You'll be terrified of the origin of psychiatry and what is still going on today.